Hi, Dr. C here. Today I'm continuing my discussion of the 4 pillars of pain relief. These pillars include detox, ambulate, hydrate, and meditate. Today I'm continuing my discussion on ambulation or exercise. This is actually a crossover video. We're going to talk a little bit about how exercise improves mood. We've discussed in a couple of earlier videos how improved mood improves pain control. I've also discussed how exercise is known to improve pain control, and I gave some specific examples. Well, this is just yet another study that demonstrates that exercise is beneficial. I've gone so far as to call exercise a panacea, and I still stand by that opinion. Of all the things you can do to improve your life, exercise is probably number one. It is basically a cure-all. It will improve every single problem that you have. And now we know that it's better than taking antidepressants for treating depression. A very interesting study was recently published. 218 separate studies were reviewed. A total of 14,000 plus patients with major depressive disorder were included in this study. It was found that simply walking 2 to 3 times per week was twice as beneficial as taking an SSRI for treating depression. These researchers found that 63% of people who got out and walked, simply walked for 30 minutes, 2 to 3 times per week, had improvement in their symptoms, whereas only 26% of subjects who were placed on SSRIs or Selective Serotonin Re-uptake Inhibitors had a similar response or as profound a response. And as I've said before, this study bears out stepping up the intensity has a commensurate effect in benefit. High intensity exercise is better than low intensity exercise, and a bit longer duration activity is better than lower duration activity. Specific exercises were also evaluated, and what was found was, at least for depressed people, depressed women responded better to strength training than men, and men responded better than women to flexibility activities such as yoga and Pilates. Sorry for the interruption. I heard my neighbor's cows yelling and I had to go and see why they were in distress. So getting back to the subject at hand, these researchers found that exercise was better than using SSRIs or selective serotonin reuptake inhibitors to treat moderate depression. It was also at least as good as cognitive behavioral therapy to treat depression, which is well thought of for managing depression and pain. And so, again, this is a very powerful tool. Because it was so large, the data can be reliable. I mean, studying 14,000 plus people gives a pretty good indication of the idea that this is a true finding and is not as prone to selection bias as a smaller study might be. I'll include this study down below so that you can review it. It was actually published in the British Medical Journal fairly recently, and it's very interesting. Their conclusions are much broader than this, and I'm happy to discuss it further if there's interest. Please like and subscribe this video so that I know that the topic is informational and useful to you. And if you have any questions, please comment down below, and I'll review these comments and I can make further videos addressing these questions in the future. Thanks for watching.